And please silence your cell phones.
Yes, please do.
First of all, a little bit about Neuhaus. Neuhaus is a professional development center for teachers. They started wanting to help children who had dyslexia by teaching teachers an effective research-based method to use with those students. But what we found is that the methods that work for dyslexic students work really well for all students. It's just a good method for teaching reading. So the methods we teach teachers to use in the classroom are for literacy. It's for literacy across the board: vocabulary, spelling, writing. So in your packet you do have a class schedule. Many of our classes are available online, so if you're interested in taking a class, feel free to contact us. So I got into this field kind of through the back door. I didn't start out in education, but I have a daughter who was diagnosed when she was 6 years old in first grade with dyslexia. She started working with a dyslexia therapist. I am an avid reader. I was horrified that my child was struggling with reading and really, really wanted to see her helped. As a result of the work that she did with the dyslexia therapist, she became a good reader. She's now a senior in college, so she is doing quite well, and majoring in sociology and history, which both require a lot of reading, so that was really good to see. But through watching her process of learning to read, I loved what I was seeing, so I became a dyslexia therapist. So that's kind of how I got into this area. After I went to work at Neuhaus, I was asked to sub one night in the adult literacy program, fell in love with working with the adults, and so that's really where my passion lies now. So before we can talk about dyslexia, we need to talk about reading. So what is reading? We have symbols, letters. Those letters have sounds. We put those together to form words. Those words have meaning. So we read to gain information. When your child is learning how to speak, we don't really have to teach them how to speak. They just naturally acquire that. Our brains are pre-wired for language. They're not pre-wired for reading. So reading must be taught. About 60% of the kids will learn how to read no matter what method you use, but about 40% are going to need a little more help, and a smaller percentage of those are going to need a lot more help. When we see a word, and we look at those letters, and each of those letters has a sound. So for example, if we're looking at C-A-T, we know the sounds are k, at. And if you put that together and you have the word cat, and then you have an image in your mind of what a cat is. So you're applying meaning to that word. So when we talk about reading, we're talking about decoding, being able to sound out that word, knowing what that word says, and comprehension, comprehending the meaning of that word. We look at reading from the perspective of a skilled reader. On the decoding side, we have instant word recognition. If you know how to read and you see a word, you cannot stop yourself from reading it. You look at it, you just automatically read it, right? And when you come across a word you don't know, you have the skills to unlock that word. You have the tools, and you know how to sound the word out. You understand syllable types. Even if you don't know the names of the syllable types, you understand that. You understand suffixes and prefixes. And when all else fails, you can rely on context. You can read the rest of the sentence, the rest of the paragraph, and usually you can figure out what the word is. On the comprehension side, you have to have that word in your oral language, or you don't know what it is. World knowledge, so much of our knowledge about the world comes from reading. So many of us know about other places, other things that we haven't actually experienced because we've read about them. Being able to think strategically about what you're reading, where you're questioning what you're reading, you're pulling in prior information, that's all helping you comprehend what you read. And to be able to make inferences, that reading between the lines, that helps you also comprehend what you're reading. Dyslexia is currently the most researched learning difference. That research is being sponsored by the National Institute of Child Health and Human Development, the International Dyslexia Association, as well as others. And what we've learned from that research is that reading relies on the brain circuits that are already in place for language. Remember that reading is culturally invented, but language we're born with. This is the left hemisphere of the brain. This is the hemisphere that's engaged in reading. When you see a word on the page, that visual image is sent to the occipital cortex, which sends it to the angular gyrus, which sends it to Wernicke's area, which sends it to Broca's area, the area for speech and language. This is a fast track for reading that's happening in the non-dyslexic brain. When you look at images of a dyslexic brain that has not been remediated, you don't see this real pretty pattern happening on the left side. You see a lot of activity taking place in the right side of the brain. It's more sporadic looking. When you see the brain post-remediation, you see a pattern that looks more like this. National Reading Panel was commissioned by Congress in 1997 and issued their report in 2000. This was a meta-analysis where they took 12,000 to 15,000 reading research studies, threw out the ones that weren't good solid research and said this is what we need to do to teach reading. This was not about dyslexia or learning differences. This was just best practices for teaching children how to read. And what we got out of that was we need to begin teaching phonemic awareness, the awareness of sounds. And we need to teach that directly, beginning in kindergarten. Before it was kind of, you know, they'll just figure it out. So we don't want to leave it up to the child to just figure it out. We want to teach them the sounds. We want to teach them the letter-sound relationships. We want to teach them how to sound out words, how to decode. We're going to give them connected decodable text, stories that they can read, they can sound out the words, and that's going to develop their fluency, the rate and accuracy with which they read, and also give them interesting stories to help develop their vocabulary. I always tell parents, read to your children because you can keep their vocabulary up even if they cannot read at the level they need to be reading at. So effective reading instruction includes direct instruction in phonemic awareness, the awareness of sounds, decoding, how to sound out the words, fluency, the rate and accuracy with which you read, vocabulary and comprehension, and these are the 5 pillars of effective reading instruction. So today we're going to talk about dyslexia, what it is, what strategies are effective in teaching students to read and spell, and also about the laws that relate to dyslexia. So first of all, is dyslexia a new term? Does anyone know?
New as in what sense?
Okay.
Since when?
Okay. Anybody know since when?
Probably 70s.
Okay. It's actually was first used in 1887.
Not 100 years. Good guess.
It may as well, anyway. It was first used by a German ophthalmologist named Dr. Berlin. Dr. Berlin was working with adults who had previously been able to read, had had a traumatic brain injury or a stroke, and had lost that ability. He called it dyslexia, meaning a difficulty with language or a difficulty with words. In 1917, there was a Scottish ophthalmologist named James Hinchelwood, who was the first one to describe clinical studies of children who failed to learn how to read, and he called it congenital word blindness. We didn't have this wonderful brain imaging going on then, so we really didn't know what was happening. This is Dr. Samuel Orton. He was a psychiatrist and neurologist, and he is known as the father of dyslexia. However, he called it strophosymbolia, which means twisted symbols. He was appointed to run a mental health clinic in Iowa. There was a young man there who was clearly very bright, but he read on a first grade level. And Dr. Orton was curious about why he couldn't read better, and he wanted to help him. He had heard of a multisensory method that had been developed by Grace Fernald, so he decided to try that. But he recognized this was a specific language disability and that this was separate from his level of intelligence. So what Dr. Orton did is he identified the syndrome of dyslexia. He separated that from other disabilities, and he outlined the principles for remediation as well as how to diagnose it. He worked with Anna Gillingham. She was a teacher and a psychologist, and she organized the English language. She found that only 15% of the English language was irregular for reading and spelling. She trained teachers to use her system. She believed in working one-on-one, so she was only able to train 50 teachers in her lifetime. Let's look at some of the old ideas about dyslexia. Do dyslexics see things backwards? Okay, well, let's see. There was a study done in 1986 by Valentino. It was a good study. Students were asked to copy designs in Hebrew alphabet letters. They were not familiar with the Hebrew alphabet. And they found the dyslexics did as well as the non-dyslexics, so they weren't seeing things backwards. Can anybody tell me what this is? Remote? Okay, what is it now? Still a remote? Okay, so most things in our world, we flip them around, they keep the same name, they keep the same function. Not our alphabet. We have the letter B, it sounds as B. Flip it, it's a D, it sounds as D. Flip it again, it's a P, it sounds as P. Flip it again, it's a Q, you have to put a U with it, it sounds as Qu. If you are struggling with remembering the name of the letter, the sound that it makes, and everybody keeps changing its name, changing its sound, it's hard to hang on to that information. Okay, so they're not seeing it backwards, they just can't remember which one is it now. So do dyslexic readers make more reversal errors than other students? Okay, well, what the research shows is that dyslexic students make more errors, but the percentage of those that are reversals is really about the same. Now, having said that, when you're working with children who are learning to read, you see a lot of reversals. Okay? When you work with adults, you might see reversals occasionally, but I've seen reversals maybe twice in the years I've been working with adults. So it's really something that's more of a red flag, but not part of diagnostic criteria. So how is a dyslexic reader different from a skilled reader? They don't pick up on the patterns of language on a phonological level or on an orthographic level. So what you might see on a phonological level is they might struggle with rhyming. I know when my daughter was little and I would give her a rhyme and I'd wait for her to fill in the rhyming word, and she would give me a word that made perfect sense but it didn't rhyme. I thought, well, we're okay, she understands what's going on, but I didn't realize that was a red flag because she was unable to rhyme. She didn't hear the rhyme. If you think about what's going on with rhyme, you're taking a word, you're recognizing the initial sound, you're recognizing the ending sounds, you're dropping that initial letter sound, pulling in a new letter sound, blending that together to make a new word. If you are struggling with letters and sounds and putting them together, that's a difficult activity. Identifying the number of words in a sentence. If you're working with students, you have them move a counter for each word in the sentence. Sometimes you'll find they're running words together, especially those little words. They'll run them together, not recognizing they're individual words. Identifying syllables in a word. And we see this a lot with our adults. They can't hear that fantastic has 3 syllables. Or identifying the individual sounds in a word. Can you take the word fan and break it down into f, a, n? Conversely, if I give them the sounds f, a, n and say, what word is that? Can they blend those sounds together to form the word? So deficits in phonological awareness reflect the core deficit in dyslexic readers. The best predictor of reading ability or disability from kindergarten and first grade test performance is phoneme segmentation ability. Can they take those words and break them down into the individual sounds? And we can tell very early on which children are going to be at risk for reading. This is called the Matthew effect. It's taken from Keith Stanovich. The name is from the Bible verse, the rich get richer, the poor get poorer. So the idea is if you are born with good phonemic awareness, it's going to be really easy for you to learn those letters and the sounds that they make. It's going to be easy to learn how to read. What happens when something's easy and it's an expectation? You're proud of it, right? Hey, I get this. This is good. So especially with children, let me show you what I can do. So they read more, they get more practice. And as they're doing it, they're building their fluency, they're building their vocabulary, and their self-esteem is good. Conversely, when you have a child who struggles with phonemic awareness, it's difficult. No matter what you call those reading groups, they know they're in the one that's not getting it. It's disheartening. They don't want to do it. If I don't like something, if I'm not good at it, I don't want to do it, but I'm an adult, so I can get away with that. But for children, that's very difficult. And that leads to adults who struggle with reading. The good news is we can teach phonemic awareness, and we can bring all that up. On an orthographic level, You're going to see difficulty with those common letter groups like TCH. You cannot take TCH and sound it out to get to ch. IGH saying I. Put an E in front of it. Now it says A. You have those consonant blends like STR. If you're sounding those out and you're looking at those letters, trying to remember, okay, this is an S, its sound is, this is the T, its sound is T, and you're slowly sounding that out, that word is not going to sound like what it's supposed to sound like. Knowing how to pronounce the vowels. Consonants are pretty reliable, 1, maybe 2 sounds. Vowels, A has up to 5 sounds. How do you know which sound to use? And dividing words into syllables. If you don't hear syllables, you can't divide the word into syllables, and then you can't figure out what the vowels are supposed to sound like. Okay, let's look at this first line, these nonsense words. Can anybody read those for me? Okay, Bowman May. Everybody agree those should be Bowman May? Okay, we all agree it's Bowman May. Okay, these are not real words. How did you know the vowels were long, the E's were silent?
The E at the end makes the first vowel long sound.
Okay, is that something you were taught, or is that some, okay. And some people say, you know, I looked at that and bohm looks like home, so, you know, I just kind of figured it's the same pattern. So however you got there, you all agreed that's what it should be, right? Now, the bottom line, I know nobody wants to attempt that. No one ever wants to attempt that, because that doesn't follow the regular patterns of English, right? But the point is, if you're a struggling reader, if you're a dyslexic reader, you probably don't recognize those patterns. And those 2 lines are equally difficult because you don't know that vowel consonant E rule. When you encounter a word you don't recognize and you need to sound that word out, first thing you can do is look for your vowels. So in this word, I have an I, an O, and an E. And at the beginning of this word, I have 5 consonants together, but I know when I learn my vowels, A, E, I, O, U, sometimes W and Y. And if Y is at the end of a word, it acts like the vowel E. If it's in the middle of a word, it acts like the vowel I. So we're going to call our Y an I. So now we can divide our word into syllables. So at the beginning, we have this vowel, consonant, consonant, vowel pattern. So we usually divide between the consonants. Over here we have these vowel, consonant, vowel patterns, but we'll divide between the N and the O and the G. Okay, so now I have 3 closed syllables where my vowel is short. So our first syllable ends in a consonant. That's a closed syllable. So the Y we're calling an I is going to be short. Second syllable, another closed syllable that ends in a consonant. So that I is going to be short. And then our last one, we have a closed syllable. So that E is going to be short. Then we have this open syllable that ends in a vowel, so our O is going to be long. Okay, so G. G is the tricky consonant, more than 1 sound, but I know that if G is followed by E, I, or Y, it's going to sound like a J. So now we know that our word is trypsinogen, which is a pancreatic enzyme, if anybody cares. But if I'm having to go through that much difficulty to figure out what the word is, am I going to comprehend what I'm reading? All my attention is focused on sounding out the words, so I'm not going to be able to comprehend. So the ability to read and comprehend depends upon that rapid automatic word recognition. Another core deficit, in addition to the weakness in phonological awareness, there's also a weakness in the ability to name in rapid succession. A lot of our students will qualify for extended time because they know the answer, they just can't retrieve it quickly enough. And so through testing, they could be tested reading a chart of letters or symbols or words, and just to see how quickly do they retrieve information. And that can qualify them for extended time. For our students who are in high school, that's very important if they're taking SAT, ACT. For our adults who are taking the LSAT, or maybe they're taking their medical boards, that extended time is invaluable. So dyslexia is a specific language-based disorder characterized by difficulties with single word decoding. Here's the definition accepted by the International Dyslexia Association, the National Institute of Child Health and Human Development, as well as others. Dyslexia is a specific learning disability that is neurological in origin. We know it has to do with the way your brain is wired. It's specific in that it impacts reading and spelling. It is characterized by difficulties with accurate and/or fluent word recognition and by poor spelling and decoding abilities. These difficulties typically result from a deficit in the phonological component of language that is often unexpected in relation to other cognitive abilities and the provision of effective classroom instruction. So we have a student who's gotten a good core reading program. They have adequate intelligence. Why didn't they get it? It's unexpected. Secondary consequences may include problems in reading comprehension and reduced reading experience that can impede growth of vocabulary and background knowledge. Studies show that individuals with dyslexia process information in a different area of the brain than do non-dyslexics. Many people who are dyslexic are of average to above average intelligence. So there have been studies to show that you can have an IQ up here, reading ability down here, okay? And I know a lot of times those who don't work in our field will hear someone reading, they read poorly, and the assumption is, oh, they're not very smart. Those of us who have worked with these really bright adults who struggle with reading know that that's not the case. So slow and inaccurate decoding are the best predictors of difficulties in reading comprehension. Reading comprehension is also impacted by the fluency. If the person who's reading has very choppy reading and they're dropping suffixes, dropping a suffix will change the meaning of the word. That changes the meaning of the passage, right? So that can affect your comprehension. Your language and listening comprehension, world knowledge, oral language. If you're reading about zebras and you've never seen a zebra and you have no idea what that is, you're not going to comprehend what that story is about. Being able to think strategically as you're reading, when you're reading a really good book and you know exactly what everybody looks like, you know what the setting looks like, you're totally engaged in the book, movies coming out, this is great, and they get it all wrong. They use different people, they don't look like they're supposed to, and it's not what you visualize. It's very disturbing, right? But that visualization helped you to comprehend what you're reading. And being able to have that inner dialogue going as you're reading, you have enough working memory freed up that as you're reading, you're questioning what you're reading. You're pulling in prior information. You're wondering what's going to happen next. Are these people going to get together? What's going to happen? That helps you comprehend what you're reading. Being able to make inferences, again, so much of what we read is not explicitly stated. It's between the lines, and you have to be able to make those inferences. And can you pay attention to what you're reading? If the student is also ADHD and cannot focus on the reading, they're not going to comprehend what they're reading, even if they're reading the words accurately. So with dyslexia, it's the phonological weakness that's primary, okay? Phonological has to do with the sounds of the words, okay, and being able to manipulate sounds in words, like rhyming, that sort of thing. Other components of the language system are intact. Reading impairment is at the level of decoding the single word both accurately and fluently. Intelligence scores are not affected and may be in the superior or gifted range, and it's present from birth. And that's from Overcoming Dyslexia by Sally Shaywitz, which is a phenomenal book. If you want to read a lot of great information about dyslexia, I would encourage you to get that book. So how can dyslexic students learn to read? They need a multisensory structured language education that includes direct instruction in phonemic awareness, the awareness of sounds, letter recognition, decoding, fluency, comprehension, in a multisensory, structured, sequential, intensive reading intervention curriculum, and that describes an Orton-Gillingham reading curriculum. Okay, so what does that mean? Structured, sequential, cumulative curriculum, which includes intensive instruction in phonology, sound symbol association, syllable instruction, morphology, syntax, semantics, using multisensory and discovery strategies. Okay, if I'm teaching a student how to read, say I'm teaching them the letter D today. So I'm going to give them a mirror and I'm going to say, look at your mouth and repeat these words after me. I'm going to read a list of words that start with the letter D. The student will echo those words and I'll say, what sound did you hear at the beginning of each of those words? D. Okay? So I'm showing them the list of words that start with the letter D, and they probably can't read those words. I'm going to say, what letter did each of those words begin with? D. Okay, so what sound do you think the letter D makes? D. Okay, let's look in the mirror again at your mouth. Let's make the D sound. What's happening when you make that sound? Is anything blocking that sound? Yeah, my tongue's blocking. My tongue's kind of hitting the roof of my mouth. Okay, so that sound is blocked. Now let's feel your vocal cords when you make that sound. Is there a vibration? If you feel a vibration, that's a voice sound when you say D. It's an unvoiced sound if you don't. So at this point, I've taught them about vowels and consonants and how to distinguish between the two. And so they know that that letter is a consonant. So now we introduce a reading deck card that has a D, has a picture of a dog, and we're going to add that to the consonant section of our reading deck. And every day, as a warm-up, we're going to practice our reading deck. And we're going to look at that card and say D, dog, D. Okay? Because when you work with students with learning differences, you know that they have it, they don't have it, where to go. Okay? So we're going to make sure we practice that every day as a warm-up, along with the other letters we've learned and the letters we're learning. Okay? So now we're going to skywrite that letter D. So we're going to stand up. You don't have to, students. We'll stand up. We'll skywrite. So we're going to do gross motor. We're going to do stroke descriptions. We're going to say D. We're going to describe how we're writing that letter. Okay? We teach cursive. The reason we teach cursive is a cursive D, a cursive B, a cursive P, a cursive Q. They don't look alike anymore. It's much easier to distinguish them. Plus, if you have a student who's dyslexic, a lot of times they also have dysgraphia, and a lot of times those words just run together and you can't tell where the words begin and where they end. With cursive, there's a natural break, right? Because you pick up your pencil and go to the next word. All right? So we're going to teach them cursive. It's also faster, okay? So we're going to practice skywriting that letter. Then we're going to trace and copy that letter, and each time we do it, we're going to name it. We're going to do the stroke descriptions. So at this point, we've probably written that letter about 20 times, 15 times. And so we have a pretty good idea of what the letter D looks like and what it feels like. Now we're going to read some words that have the letter D, and we're going to use the letters that we've learned previously. Okay, this is cumulative. And so we're going to practice reading. Now we're going to learn the letter D for spelling. So when we do spelling, when you hear the D sound, how are you going to spell it? With a D. So now we've got a spelling deck, and so we're going to add the D sound to our spelling deck. Okay? So we're going to practice spelling words that have the letter D as well as the letters we've previously taught. And then we're going to work on other things like grammar, practicing reading, vocabulary, sentence structure. So we're going to pull in all of these things. So we're going to teach them the 6 syllable types. We're going to teach morphology. We're going to start with those simple suffixes. We're going to add prefixes. We're going to get into roots, Anglo-Saxon, Latin, and Greek roots as we get farther into the program. And by doing this, this also teaches them vocabulary because they're learning those roots. They're learning how to put those roots together to form larger words, how to break down those larger words, and they're going to understand what they mean. Okay? We're going to teach grammar. We're going to teach them the proper usage of the language. Okay? And this is all very multisensory, and it's a discovery strategies because we're having them discover the letters, the sounds, the properties of the sound. The program that we teach dyslexia interventionists to use at Neuhaus is called Basic Language Skills. It's an Orton Gillingham program. There are a lot of really good Orton Gillingham programs out there. It tends to be geographic. We're in Houston. If you go to Dallas, you'd probably do Scottish Rite, which is very similar to our program. Our program is accredited by IMSLC, the International Multisensory Structured Language Education Council. To become a dyslexia therapist in the state of Texas, this is law in Texas, requires 200 instructional hours and 700 supervised clinical hours. So, is dyslexia more common among boys than girls? Anybody know? Girls, okay. What do you think? Okay. People usually say boys, that's why I was surprised. The reality is I don't know the answer to the question. Used to, boys were identified more than girls. Boys will Rather than be embarrassed in front of their friends, boys will be the class clown. They'll get in trouble, they'll get kicked out of class, but don't embarrass me in front of my friends. So boys got identified more. Girls would sit back there, kind of, you know, sink down the chair, the hair comes down, oh, she's sweet, she's shy, don't call on her, right? So the girls would kind of go under the radar. We started doing RTI, response to intervention, where we were doing regular progress monitoring. And we saw more girls being identified. So the number of girls started coming up. Some researchers, Sally Shaywitz, says the numbers are about the same. In my private practice, I saw more boys than girls. In our adult literacy program, every semester it's pretty much 50-50 men and women. Some researchers say more men than women, but I don't know. The bottom line is boys respond differently than girls do. Will you outgrow dyslexia? That's a silly question to ask people who do adult literacy. We know you don't outgrow it. A longitudinal study that was done showed that children who were reading disabled in grade 3 received no specific remediation. By grade 9, 74% remained reading disabled. So you don't outgrow it. It's something that if you see a child who's struggling, you need to help them, not wait for them to spend another year getting farther behind. Yes?
Does the state of Texas have any type of testing or requirement of young students, kindergarten,
Yes.
first graders?
And we're going to talk about that.
Okay.
Good question. So, are there many dyslexic students? Does anyone know the percentage of the population that's dyslexic?
Big.
I don't think it's recognized, I don't think it's identified as.
I agree. It is not identified the way it should be. It's actually about 20% of the population. Depending upon the researchers that you listen to, it's 15 to 20%, but 20% is becoming more the generally accepted number. Keep in mind that dyslexia is on a continuum. You can be mildly dyslexic, severely dyslexic, and anything in between. If you're severely dyslexic, it's probably going to be noticed, hopefully. So, can you inherit dyslexia?
Tendencies.
Okay. You can inherit dyslexia. A lot of research going on in that area now. So it's important if you work with adults who are dyslexic and those adults have children, there's a good possibility that those children are going to be dyslexic and need some help. And guess what? You're the reading expert in the adult's life. So they're going to come to you and say, what do I do to help my child? I don't want my child to have the same path I had. What can I do to help? So we're going to give you lots of information about that. Are students with ADHD also dyslexic? Okay. Yeah. It's what's known as a comorbid condition. You can have both, or you can have one, or you can have the other. I haven't seen any research connecting them, but it certainly impacts your remediation of dyslexia if the student also has ADHD and is having a hard time focusing on the instruction. So today we're going to talk about the law, Section 504, which is tied in with the Americans with Disabilities Act, IDA, the special ed law, and the Texas Dyslexia Law. So first of all, IDEA, special ed law, was passed by Congress in 1975. It was revised in 1995 and again in 2004. There are 13 areas in which you can qualify for special ed. One of those is specific learning disabilities, and dyslexia is listed under the specific learning disabilities. So how do you qualify? You need a referral. You need testing. They used to require a 15-point discrepancy between 16-point discrepancy between IQ scores and achievement test scores. Then you have these kids who have a 14-point discrepancy, a 13-point discrepancy. They still needed help. So they said, okay, well, we can rely on our RTI data. We have tried intervention with this student. It wasn't enough. They need special education. So now they're going to form the Admission Review and Dismissal Committee. This committee includes the parents. Parents are a full voting member of the committee. Okay? Parents have lots of rights under special ed. Students have lots of rights under special ed. So what we're going to do with this committee, we're going to get together, we're going to meet, and we're going to decide what is in the best interest for this child. I always tell parents, when you go to an ARD meeting, when you go to any meeting like this about your child, take somebody with you as an advocate, either a hired advocate, but usually you start off with maybe a friend or your sister or somebody who can go and just be supportive of you, because it's very emotional when you're sitting there with all these people, no matter how much they love your child, no matter how much they want to help your child. They're talking about the areas in which your child struggles. And as a parent, that's very difficult and it's very emotional. So you need somebody there to help you remember the questions you were going to ask, help you kind of keep your head clear and decide what you want to do. If you think that what they're offering is what your child needs and this is a good plan, then by all means sign off on it. If you're not sure, you may want to table that discussion and get some more information. Yes, you're going to delay helping your child, but it also ensures you aren't making an uninformed decision. So what comes out of this is the individualized educational plan for your child. So your child's going back in the classroom, they've got this plan, everything's going to work for them, the help they're going to get, okay? The accommodations, everything's good, right? How many kids are in that classroom? How many kids have IEPs? Your teacher is overworked and underpaid and she's trying to keep this all straight. And your child goes to the next grade or maybe moves from elementary to middle school. Did the plan even follow them? Okay, so you still have to, the parent still has to stay on top of it and monitor it. This is very difficult for a lot of our adult students because they too have learning differences. They don't feel comfortable going in and talking to school. They're intimidated, and so it's hard for them to do this.
What was this discrepancy between IQ and what? 16-point difference?
IQ and achievement. So we also have 504. If a child is in special ed through school, they graduate from high school, they're no longer special ed. But 504 will stay with them. But what 504 does is it gives you accommodations. Okay? It doesn't change the test at all to make it easier. You get accommodations like extended time. Okay? So this legislation came about in 1973. We had our Vietnam vets returning home. Many of them had injuries. They needed help. What can we do for them? Okay, we have someone who's in a wheelchair. They go to Target. There's a huge parking lot. How are they going to get from there to here? Well, let's reserve some parking spaces up front. We're going to make them wider spaces so they can get in and out of their car. Once they get in, and we're going to have doors that are wider and open up for them. We're going to have restrooms with safety bars and wider stalls. In our building at Neuhaus, our offices are all on the second floor. Our first floor is our parking garage, so we have to have an elevator so you can get to the second floor. That's all part of Americans with Disabilities Act. That all falls under 504. So what it's saying, I can't prevent you access to my building or my place of business. I also can't prevent you from accessing reading, from learning, from thinking. So I'm going to make some accommodations for you. Maybe you need some preferential seating. Maybe you can't focus, so you need to sit closer to the teacher. Okay, maybe you need to take your test in a quiet area so you aren't distracted by other people finishing more quickly. Maybe you need more time to take your test. Maybe you need time and a half to take your test. That's all 504. And this covers our adults if they have a diagnosed learning difference. And we have the Texas Dyslexia Law. This is the answer to your question. Texas Dyslexia Law has been around for over 30 years. This impacts children who are in school, okay, the children of your students. So the law is meant to cover the dyslexic student whether they're in regular ed, 504, or special ed. There is a Dyslexia Handbook available from Region 10. The Dyslexia Handbook is over 150 pages. So if you want to get the handbook and look up any of this later, when you see the scales of justice, that tells you we've taken that from the handbook, and that's the page number where you can find it. Definitions and characteristics of dyslexia. The student who struggles with reading, writing, and or spelling often puzzles teachers and parents. Dyslexia means a disorder of constitutional origin manifested by a difficulty in learning to read, write, or spell, despite conventional instruction, adequate intelligence, and sociocultural opportunity. You can see how that mirrors the IDA definition of dyslexia. It's shorter, but it covers all those main points. Characteristics of dyslexia: difficulty reading words in isolation, difficulty accurately decoding unfamiliar words, difficulty with oral reading, slow, inaccurate, or labored, and difficulty with spelling. These characteristics are most often associated with difficulty with phonological awareness, the awareness of sounds, difficulty with learning letter names, the sounds that the letters make, with phonological memory, can they remember those letters, remember those sounds, and rapid naming. And those consequences may include variable difficulty with aspects of reading comprehension, with written language, with limited vocabulary growth due to reduced reading experiences. A lot of times we'll see these kids who have, and adults too, who have a larger speaking vocabulary than is reflected in their written work because they're insecure about their spelling, so they dumb it down when they're writing to words. Okay, I don't know how to spell this word, I know what it means, but this word is safe to spell. So a lot of times their written work is not reflective of what they're really capable of doing. So how can we prevent reading failure? Texas law requires schools to administer early reading instruments to all students in kindergarten through 2nd grade to assess their reading development and comprehension. It goes on to say that in kindergarten we need to start providing some intervention. And in 1st grade we need to start providing remediation. So the law doesn't say wait until they're 3rd grade, maybe they'll get it. The law says look at these kids when they're young. Start helping them right away. Does that answer your question from earlier? Okay. The school must also implement an accelerated, intensive reading program that appropriately addresses the students' reading difficulties and enables them to catch up with their typically performing peers. So we don't want to exit these students too early from the program. They have to stay in the program until they catch up with their peers. School districts are required, and this includes charter schools, are required to identify students with characteristics of dyslexia, make available early identification, again, screening them kindergarten through 2nd grade. Provide appropriate intervention and support for students with dyslexia and related disorders. And by the way, dysgraphia is listed as a related disorder. Provide access to appropriate instructional services on each campus. By each campus, they mean each elementary, middle school, and high school. This is not limited to elementary. These are the 8 domains they need to assess. Letter knowledge, do they know the name of the letter? Do they know the sound that it makes? Reading words in isolation. They can't rely on context if they have to read the words in isolation. Decoding unfamiliar words accurately. And this is usually those words like Bowman made, nonsense words that follow the regular patterns of English. It might also be called a word attack score or pseudo word naming. Reading fluency, both rate and accuracy. Reading comprehension, spelling. And I want to say here, a lot of times these kids will have an A in spelling because they memorize the words for the test. And so the mom goes to the school and she says, there's a problem. They say, no, they've got an A in spelling. So I always tell parents, be sure to take in samples of their written work because a lot of times those kids couldn't spell those words the day after the test that they got an A on. Okay. Phonological and phonemic awareness, rapid naming of symbols or objects. Again, they struggle with retrieving the information quickly. Instruction for students with dyslexia. Districts shall purchase or develop a reading program for students with dyslexia and related disorders that incorporates all the components of instruction and instructional approaches found in the handbook. So they can't just work on fluency or just work on spelling. They have to cover all the components. Okay, those components include phonological awareness, sound symbol association, syllabication, learning the 6 syllable types, orthography, learning spelling patterns, morphology, prefixes, suffixes, roots, syntax, grammar, reading comprehension, and reading fluency. Yes?
In a previous slide, you listed the number of hours that a person needed to have to be a dyslexia specialist.
Yes, and that is not required under the law. That's if you're in
So
private
anybody could be
practice.
teaching these classes.
They're supposed to have appropriate instruction. Appropriate instruction, which is not defined. You don't have to be a dyslexia therapist to be in the school. There are some. So let's look at the strategies for effective instruction for students with dyslexia. So this is a lot of what we talked about with that Orton-Gillingham method. Simultaneous, multisensory. That VAKT stands for visual, auditory, kinesthetic, tactile. So we're approaching these kids from all different angles because we know some of our kids our students are visual learners, some are auditory learners, some are tactile kinesthetic learners. It needs to be systematic and cumulative. Okay, we're teaching a sound at a time. We're adding in new sounds. We're still practicing the sounds that we learned previously. Explicit instruction. We're not leaving it to chance. We're teaching. This is the letter. This is the sound it makes. Diagnostic teaching to automaticity, synthetic instruction, and analytic instruction. We're teaching the whole to the parts to the whole. Can you take the word fan, break it down into f-at-n? Can you put it back together? Essentials for a successful reading intervention program, it needs to be early. For those of us working with adults, we know it's so much more difficult for our adult learners. It's harder for them. We don't learn as quickly as adults as we do as children. It needs to be intense instruction. Typically what we recommend for children is 4 to 5 days a week, an hour, 45 minutes to an hour a day. Needs to be high quality instruction of sufficient duration. So you don't say, oh wow, they're making progress, let's stop. Okay? You want to keep going. This is from the Florida Center for Reading Research, which is housed at Florida State University. This is an excellent resource if you want to know about reading research. And what they found that as long as you're using a good program that addresses all the things we've been talking about, which program you use is less important, but make sure it's a good program that addresses all these areas and you stick with the program. This is kind of a checklist if you're working with a parent who wants to get their child tested through the school. They need to always put that request in writing. If you don't put it in writing, it never happened, okay? A lot of times parents say, well, I stopped the teacher and told her in the hallway, and that was 3 months ago and nothing happened. Well, probably 10 other people stopped that teacher before she got back to the classroom, but you have to put it in writing. So what do you put in writing? You put your letter. I want to have my child tested according to the Texas Dyslexia Law. This is what I'm seeing. So a parent may not know that their child is struggling with phonological awareness, but they will know if their child can rhyme. That's under phonological awareness. Difficulty learning the names and the sounds of the letters. Difficulty with reading single words in isolation. Difficulty recognizing common sight words. You know, when my daughter was a struggling reader, and one time she was reading, she came across the word the. She said, what word is it? I told her. 5 words later, same sentence. She said, what word is that? I said, it's the same as that word. I don't know that word. I just told you. I don't know that word. They don't hold on to it. Okay? They need lots of repetition. So especially those common sight words, you can't sound them out. You just have to memorize them. Inaccurate and labored oral reading. Difficulty reading aloud. Difficulty in word finding and rapid naming. They just can't retrieve the word. Reliance on listening rather than reading for comprehension. They read something, they say, this doesn't make any sense. You read it to them, they say, oh, okay, I get it. They learn that way. Difficulty spelling words the way they sound. You look at the word they've spelled and they don't have a letter for each of the sounds in that word, or they have some letters that you certainly didn't hear in that word. Difficulty with written assignments. Again, you don't see what they're capable of in their written assignments because they have the fear of spelling. And a family history of similar problems. We know dyslexia is genetic. Okay? The law recognizes that it's genetic. So put that in the letter. So not every dyslexic student is going to present differently. So not everything on this list would apply to every child. So you pull the things that do that are significant for that child and put those in the letter and say, I want my child tested because. So what's the prognosis? Depends upon the severity, the age of intervention, the support of parents and educators, innate intelligence, and perseverance. Can dyslexic individuals be successful in life? Absolutely. I have a phenomenal class right now. I have a CPA in my class. I have a very successful entrepreneur. They have college degrees, but they don't read where they need to be reading to feel really successful. So, but they are successful. So what's a parent to do? Educate yourself about reading and dyslexia. Share what you learn with your child's teachers. A lot of times teachers don't know about dyslexia. There's a relatively new law that says pre-service teachers must be taught about dyslexia. Whether they're going to be coaches or first grade teachers, they need to know about dyslexia. But a lot of the teachers out there really don't know, they don't understand. We have a lot of information that's available through our website, through the International Dyslexia Association that you can print off for your students to take back to the schools. Ask questions, learn about the reading programs that are being used in the child's schools, which curricula are being used, how and when is progress monitored. Be proactive and involved in the child's education inside and outside the school, and network with other parents. When my daughter was diagnosed, I talked to the moms of all of her friends because I just knew she was going to be over there, something was going to happen, and the other child was going to discover that my child couldn't read, and it was going to be horrible. So I told all the moms, this is what's going on, my daughter has dyslexia. And then you have to explain what dyslexia is because most people don't know, and what we're doing about it, and she's going to be fine. And what came out of that was I found that the other parents were more comfortable talking to me about issues their children had. So I no longer felt as isolated. The other really good thing that came out of this is my daughter saw me talking very positively, very openly about her dyslexia, which made her comfortable with it. She realized, okay, this is not something I need to be ashamed of. This is the way I am, this is the way I learn, and it's going to be okay. And that made her very comfortable with talking about it. And now that she's in college and having to advocate for herself, she's very comfortable with saying, I'm dyslexic. This is what I need to be successful. I need more time on this test. I need a quiet area for testing. I can't do that for her now. So you want to get them to that comfort level. Here's some good websites. If you contact us back at the office, I can send you a website resource guide with more websites. The International Dyslexia Association is a fabulous resource. They have some fact sheets available on their website. They're 2 to 4 pages long. It's free to download them. They have them on a variety of topics: dyslexia, ADHD, spelling, dysgraphia. They have them on transitioning to post-secondary, adults in the workplace with dyslexia. So a lot of good fact sheets there. I would encourage you to check their website out. I would also encourage you to join the International Dyslexia Association. It's a fabulous organization. They do a lot of work and support a lot of research. If you're in the Houston area, the Houston branch of the International Dyslexia Association is very active. We have 2 conferences, I say we because I'm on that board. We have 2 conferences a year. The Fall Symposium, which is going to be on September 26th, is on motivating older students. Really great speaker coming in from Haskin Laboratories. Great reading research at Haskin Laboratories. Of course, our website, we have a lot of good information on there. The Yale Center for Dyslexia and Creativity. There is some phenomenal research coming out of the Yale Center. This is where Dr. Sally Shaywitz is doing a lot of her research along with her husband, Dr. Bernard Shaywitz. The nice thing about their website is everything that's on there, you can click on it and it will read it to you, which is, I don't know why no one thought of that before. It seems so simple, but of course people who struggle with reading would need that on a website. So that is a phenomenal website. Reading Rockets has good activities for children. Writes Law, if you are working with parents who have kids in school who are special ed or need to be in special ed, Writes Law is an invaluable website. It is a great resource. Lots of material on there about how to advocate, what the law is, what that means, translating the law into plain English. Great website. We have a booklet that we've created for parents called You Can Help Your Child. It contains a lot of the information that we've talked about here today. If you call us, I'm happy to mail those to you. You can go to our website and download it. We also have it for download in Spanish. And this is the Dyslexia Handbook we've been talking about for the Texas Dyslexia Law. I have problems with this website. I always just go region10.org. I type dyslexia in the search box to find it. It works for everybody but me, I don't know. But the handbook, they have an interactive copy you can look at online. You can download it. Like I said, it's over 150 pages if you want to print it. You can order it from them. I think it's about maybe $13, but it's a really great resource. And one of the services we offer at Neuhaus, we have Neuhaus Academy. This is a free website you can go to. There are 3 pathways. The first pathway is phonology and orthography. It teaches the sounds, the spelling patterns, syllable types. The second pathway is morphology, semantics, and syntax, which focuses more on vocabulary, comprehension. The third pathway is the combination of pathways 1 and 2. It is free, and there are downloadable worksheets for each activity. And I'm Mary Yarus. This is Suze Hall sitting in the back. Suze is in family support and also adult literacy. She manages our small scholarship program that we wish was larger, and she also teaches in our adult literacy program. She's also worked a lot with adults on math, so if you have questions about math, talk to Suze. Okay. And that's it. Do you have any questions?
We have time for questions, so please ask questions.
I have a question.
Yes.
Why is it pronounced Neuhaus?
And why is a center that's all about reading and phonics based called, yeah, I know, because
Mispronounced.
there is this wonderful family, the Neuhaus family in Houston, who they were one of the families that helped start our center. And as these families were working together, deciding what they were going to do and what the center was going to look like, Oscar Neuhaus passed away.
Is it German, Austrian?
It's German, and there are 2 branches of the family who pronounce it differently, but we got lucky and got the Neuhaus branch, Neuhaus pronunciation. Wonderful family, but it is a strange name of a center doing what we do. Anybody else? Yes.
We haven't signed in to, we haven't signed in, we need to get you signed in.
We use volunteer tutors to work with adult
Mm-hmm.
learners, and so one of the issues we have is diagnosing someone in the first place, and then if we have a diagnosis, what to do with that.
Right.
So you guys, as you said, have a small scholarship program. We're working, the classes are free to our learners, that's
Right.
usually for a reason. So we've always struggled with that. We
Mhm.
suspect dyslexia or some other learning difference in a lot of our reading students, but it can be one of those minefields. Do we even try and diagnose? Because for that scenario, how helpful is that? Once
Right.
you stick a label on, well, you have dyslexia,
Mhm.
and now go on as before, because what can we do with a volunteer tutor? How much training can we provide? What
Right.
differentiation can we do? So what would you recommend for that?
Okay, well, there were several questions in there. Yes. So first of all, in the testing, to diagnose someone with dyslexia, you have to be a diagnostician,
Exactly.
okay, and qualified to make that diagnosis. The nice thing about getting that diagnosis is you qualify for accommodation. So maybe you need extended time. Maybe you're a plumber and you need extended time to take that exam for your license, okay? Maybe you're in law school and need extended time so you can pass the bar. Testing is expensive, and that's hard to come by. We have some resources, and in the Houston, if you're in the Houston area, you can call us and I can give you some resources. It's possible you could get some scholarship money toward the testing. There's one organization who has told me that they will help pay for testing if it's job related. There are organizations like DARS that will help pay for it. So those are some options. Sometimes it doesn't really matter if you have a diagnosis, you just want to learn how to read, okay? So in terms of the instruction, it depends. If you're using a pretty good program and the person who, your dyslexic student, is not severely dyslexic, what you're doing might be helpful. If they really are severely dyslexic, you probably want to send them to us, quite honestly, because you're in Houston. So, and I know a lot of times we have students we send to you because there are things that you do that we don't do. So you really do need to work with somebody who is a non-reader, a very low kindergarten, first grade reader who is dyslexic. It's not just the lack of instruction. It is very specialized. But you know, if you have somebody who's working with them who's extremely patient, has a good understanding of it, and is ready to approach each letter and sound, and
We do have a lot of those. As I said, it tends to be the smaller group when they're not making the progress, and we're trying to work out what's going to be best for both. So obviously the learner first, but then also for the tutor, what help do we give them so they don't get discouraged?
Right.
So it sounds like the starting point would be we need to try and get some testing and then take it from there.
right. And we also have classes. You know, if you want to send them to us, you know, talk to me. Maybe there's something we can do together. I would love to see that happen. Sure.
Can I just add something too, for those, if any of you can teach GED, once a person is tested and diagnosed, they can get accommodations on the GED exam.
Absolutely.
It is a process to go through, and it does take some time, so you don't want to wait until they're ready to test and then try to go through it. But we have students who have been allowed accommodations for extra time, private room, those kinds of things. So they are entitled to that, and it does make a difference.
It does. And
Have you had any issues on that with the new test? I mean, I know it's virtually the same process, but like I was talking to a test examiner in San Antonio, and they said since the test changed, they haven't had anybody come in with accommodation requests.
wow.
Our organization.
Of course, the
has
accommodation
had
requests
specific-
don't go through the test
Yeah,
center anymore. They go
We
through
have
Pearson.
students who've been
They
granted
have.
accommodations,
Yeah.
but not all testing centers, or what our experience has been in my career in Fort Worth is that there are certain testing centers that seem to be more easy to deal with, and we
Right,
send
right.
our students to certain
I was worried
places.
because there's so many new testing centers that aren't connected
And
to
in order
schools.
for a student, when a student is granted accommodations, they don't register the same way. They go online and they sign up, and then one of the questions is, do you need accommodations? And when they answer yes, that stops their registration. Then they get a phone call from GED Testing Service, who then says, here are the 4 places you can go, or the 2, or the 1, or the 3, or whatever, which of course transportation can become an issue. So it may be that that testing center is not one that GED Testing Service is sending anyone to. So
Okay.
GED Testing Service decides, gives them their choices, unlike a student without accommodations that can go online and see all the testing centers.
Thank you, because we don't do GED, so I'm glad you had that information. Anybody else have a question? Yes.
As far as classes, these are classes like for us, for educators,
Yes.
but as far as classes for, do you have classes for students, like high school students or even adults?
We have an adult literacy program in the evenings.
What does that exactly consist of? I mean, is it?
All of our classes are taught by dyslexia therapists. So we do pre-testing to determine placement. So we look at their reading ability, we look at their language ability, and we place them according to that. Placement is very, very important with adults. You want to make sure that they're in a class with other students who are at the same level so that they don't become frustrated. The students who read better, you don't want them to become frustrated and feel like they're being held back. So placement is very important. So we currently only have 4 classes. We have 2 classes that get the basic language skills curriculum we were talking about today. That is a much slower pace, very basic language skills. We have 2 classes where we're doing a program called Multisensory Reading and Spelling, which is a faster pace. It's very scripted, and we sell the manuals. They're very scripted. If anybody's interested in doing that, you can certainly.
What is the cost of that?
Of the manuals?
No, the training.
Oh, basic language skills, it's expensive. It's, Suze, do you remember, is it $2,000? It's like $2,000 for the first class, which is a 2-week class. All the materials are included, they're all reproducible, but it is expensive. So,
It's $2,000 for a student who's dyslexic to go in?
no, for a teacher to
Okay.
learn how to teach the curriculum.
Okay, but for students is what I'm asking.
Oh, I'm sorry, I misunderstood the question. For students, we charge $200 a semester, and we try to have a scholarship program whenever we have the funds available for that.
Okay, and that's for adults, so it's 18 and up.
Mm-hmm. I have taken a couple that were seniors in high school because they had a teacher who said, look, they're just not getting the help, can you squeeze them in? So we have done that.
And that runs, like you said, semester by semester?
Mm-hmm. Through the school year. I saw 2 hands. You first?
I have a question. Are there various degrees of dyslexia? Because if you wasn't caught at childhood and you're an adult now, so are there different?
It's on a continuum. You can be mildly dyslexic, you can be severely dyslexic. So, yes. And you had a question.
How many adult students do you have in a class?
Well, you know, there's a lot of attrition with adult literacy. You know, you get so I try to start the classes kind of larger, but by larger, maybe 10. With the basic language skills classes, we try to keep those a little smaller because the instruction is so detailed, specific, and it's, you know, it's a much slower pace. And so we try to keep those smaller. We usually start with those around 8 people. We found that the basic language skills students, because they're the ones who come in as non-readers or very, very low readers, they tend to stick around and really, they want to learn how to read. They're very serious about it. The ones who come in, the multisensory reading and spelling students who read better, sometimes they'll come in for a while and it's kind of like, okay, now I get it, and we'll kind of move on. But the basic language skills students tend to stick around. Research shows that for an adult when an adult is getting reading instruction, that for every 100 hours of instruction, they'll improve their reading by about 1 grade level. So it is a very slow process with adults, so be patient. They'll get it. Am I out of time? Oh, we have another question. Do I have time for a question?
Is there any correlation between the auditory processing disorder? You might repeat.
Yes. Oh, I'm sorry. I meant to do that. She asked if there was a connection between auditory processing disorder and dyslexia. There are a lot of comorbid conditions. For example, my daughter was also diagnosed with auditory processing disorder. The things that we did to help her with the dyslexia also addressed the auditory processing, but she's also ADHD, and honestly, I couldn't really tease out which thing was really going on. So there's a lot of accommodations going on with some things. Anything else? Yes?
I just wanted to share, I don't know exactly everyone's backgrounds here, but I have taken a class at Neuhaus, and y'all do a really
good.
good job. It's been
Thank you.
many, many years ago. And my background is teaching from kindergarten up to high school, and I have children who are dyslexic. So with that said, I was a kindergarten teacher and teaching bilingual classes, and I had to bring it to the attention of the administrators that these children, they're bilingual, speaking Spanish, but they're learning, and I knew that they were dyslexic, and she was trying to say that we needed to give them times because it might be the language, and I said,
Right.
no, it's not. So there's going to be a little problem when you're talking about bilingual adults and students, you know. Adults not so much because they know their first language, they're learning
Right.
their second language, but so you run into some things sometimes.
I didn't hear all you said, and I want to hear what you said.
Oh, that's
Bilingual and when you suspect a bilingual student is dyslexic?
When you know, children in kindergarten should be able to read certain words before they leave, and some pick up right away, and then some are struggling. And because I've had some training, and because I had children that are dyslexic, I knew I could see that, but I had a problem with my administration telling me, oh no, you know, you have to give them more time because they're learning a second language. It's not so much that they're dyslexic. And I said, no, I am a second language learner. I understand these children. I've been there, and I can see it right now. It's going to be a problem, and it was. It ended up being.
I have a problem with this. That's why I want to hear.
Yes. So you'll find that, and so we all need to be aware of this, be educated on it, and learn more about it.
Thank you.
Yeah.
Thank you. Glad you added that. Okay. I guess we're done. Thank you.
So much.